And, okay. The reason why I say that is...
You just said, here we go, in the car.
But you have to say it in an accent, like, here we go, in the car. Is because back in, like, 2011... Do you remember Jenna Marbles? Were you ever a Jenna Marbles? Okay.
I haven't thought about her and...
I think about her daily. I miss Jenna Marbles so much.
What was she on?
She was just like a YouTube... She was like one of the first YouTube personalities.
Is that it?
Yes.
She wasn't on TV?
Never. No, she was just like a YouTube sensation. And she's not been on YouTube for like 5 years. So like I am living in the past. But she did some video, and I remember it was like what girls are like in the car. Something that like it's not good content. But 2011 aged Olivia latched onto that. So anytime I do something or I'm like, okay, time to go, I go, here we go, in the car. Because that's how she said it. That's how she said it. And that's a little peek into my life. Welcome to the Medicare Cafe.
It is 10 o'clock on the dot.
It is 10 o'clock on the dot.
Not too early.
No, because we had things to catch up on. We had things to discuss. But before we get to talking, today's title is Frustrations versus Opportunity. What I wanted to talk about specifically today was like things that clients get frustrated about, things that you, the agent, get frustrated about, and like how to change your mindset on that. How to make sure you see it as an opportunity. Before you said that you had something happen to you that's kind of like rocked your world.
Yes. So it's twice this week, and it's Tuesday. So... One yesterday and one today. Some would say
a trend, maybe.
So you know me. I am, and maybe you're going to harp on me for having my 2-meeting close.
No, I mean, no. So if it works for you, then why would I tell you not to?
It's always worked for me. But I usually meet with somebody when they're like 64 and a half, like before they even have their Medicare card.
Right.
And so we have an educational meeting, and then we have a follow-up meeting. And so this one guy... We had that several months ago, and he called me to tell me he got his card. And he called, I didn't answer. I was in a meeting. He called me back like an hour later and was like, you know what? He lived in Moberly. And he was like, I found out there's somebody in Moberly. I just think I'd rather have somebody that's 2 miles away from me. He was like, you've been absolutely wonderful. I feel so terrible that I wasted your time.
I hate that, yeah. Do all the work.
And he was like, but I just don't want to come. I don't get to Columbia that often. And I was like, oh, okay. I get it. I get it.
It's sales. It happens.
But still frustrated me.
Sure.
And Moberly's not that far.
It's 30 minutes.
And then just before I walked in here, a client of mine from St. Louis, we have had 2 meetings. And she's kind of high maintenance. So it's really...
You're not that...
Maybe I'm winning at this one. But we've had, get this... At least 4. Not like we had one Zoom and then like she calls me all the time. She is so stressed. She's went to 2 seminars in St. Louis.
Oh, bless.
She just can't figure out what she wants.
Okay.
And she was like, I need somebody to come to my house and just sit down with me. And I was like, okay. And she again sent like a whole paragraph apologizing. I wasted your time. But that's weird.
I mean, 2 in the same week.
2 in the same week because they wanted somebody closer to home.
And that's just interesting because it's not like
the way... It never happened to me before.
It's not the way that the industry is going. Like, the industry is very heavily going towards... Remote. Zoom meetings.
So many people I meet with, like, we don't even have that second meeting. It's just like, oh, yeah, I'll send it to you electronically.
I'll just send you the e-apps.
Yes. So that was new for me, but I'm like, man,
that's hard.
It is.
That's hours. Hours that you're not getting compensated for.
Yes.
But at least they gave you a reason. The worst thing, and I hear it often, is they'll say, hey, I went ahead and signed up for that plan you talked about. I know you're really busy. I didn't want to waste any more of your time, so I just went ahead and signed up for it myself.
Yeah.
It's like, that's not how this works.
Yep. It's the worst. Other thing that's weird is both of those were financial advisor referrals.
Oh.
I know. Like, usually my FA referrals are like 100% close rate.
They're closed. They're not going anywhere else.
So I need to reach out to the advisors. But I think I will get them back. There's no way those people are going to service them as good as I will. So I think they'll be with them for a year.
Especially that one.
And the advisors, I know, will like follow up with them and be like, you should have chosen Kari.
Yeah. Yeah, you're going to regret that.
At least I'm hoping.
Like, a scorned ex-girlfriend. You're going to regret this. The best thing that's ever happened to you. Today.
No.
Well, okay.
I sound all high and mighty, but I will never speak like that.
I mean, me neither. For sure.
I mean, to a client.
Oh, no. Well, I have worked with agents that literally was like called up their clients that have switched and have done that, like scorched earth. You will never find a better agent. Don't you dare try to come back to me.
Gosh.
Like scorched earth. You actually know a couple of them.
Oh.
So here's some tea. Anyways, so why do we want to talk about frustrations? Why do we want to, and maybe like we can dissect this frustration you had, find the opportunity. But again, check the mindset. We deal with, oh, I like that. Kari is the Taylor Swift of Medicare. I believe that. Your husband is nothing like Travis Kelce.
Oh, that is hilarious and so sweet.
But again, this is what we're trying to do is like, I'm a full believer. I'll say it like this. If you listen to any of my seminars or my speeches, I'm a full believer that you only get so much energy allotted per day, right? Like if you drink caffeine and try to get more energy, what happens? You have a caffeine drop. Like you have the crash on the other end of it. You stay up really late one night. You're stealing from the next day's energy. What happens? The next day you're more tired. We only have a amount of energy to spend every single day. So where do you want to invest that energy? You need to make sure you're investing that energy in productive, positive things. The more we spend time, quite frankly, bitching and moaning about something, you're wasting energy. So the sooner we can flip around these mindsets, the better off you're going to be.
That was my problem. Yesterday, I had that mindset. I was just like, whatever, I get it. He wanted to stay in Moberly. But today, it really got me. It's like, two? So I do need to switch my mindset. But I did by remembering how high maintenance she was.
That sounds like when you get to a certain point, you can choose your clients. It sounds like this is a good client to choose. Like, I'm probably going to spend more in resources than I'm going to make in commission with that one. Number one, and I actually took mostly, I know you sent me a big list of things that are like frustrations, and the income-related monthly adjusted amount, IRMA. Is one that you deal with quite a bit because you work with financial planners. Reminder, IRMA is what will increase the premium of Medicare Part B and Medicare Part D. If a client makes too much money, they have to, it's not a penalty, but it's an adjusted amount to compensate for their higher income.
So my recent frustration with IRMA, like usually I talk about IRMA with all of my, I talk about income with all of my clients in that initial meeting. So usually I'm bringing it up far in advance that they know about it. They know if we can appeal it.
Yep.
But these were current clients of mine who've been clients of mine for 2 years. And when we first met, they weren't subject to IRMA.
Right.
And so, they weren't subject to it, so they probably forgotten that was a thing.
Well, of course, like it's 2 years ago. I don't remember something that didn't affect me 2 years ago.
And they are farmers.
Sure.
And, income fluctuates significantly from year to year. And they purposefully, maneuvered some income.
Of course. We're all business owners. We all know how that goes.
They came in so mad. They were like, what is going on with my Medicare premiums? And we appealed it.
Yeah.
So
yeah.
But
it's all about I truly believe success is only measured by how well expectations are met. And it doesn't matter. So it's good to know, again, based on these clients, this is somebody that I should be talking about IRMA with at every appointment versus not. But you did everything you should have on the first one.
Yeah. And it all ended so good. His wife was like, you just always calm us down. I forget what she said, but she was like, I'm just so glad, you always fix everything. Or, you are happy that they had me.
Yeah.
So
it's the opportunity there is just, an opportunity to provide service, an opportunity to provide support that, how would they know to do that without you?
Exactly. They would have to call Social Security, which nobody likes doing.
No, it's my
since
nightmare.
they were the one that sent them the letter.
My nightmare.
And they wouldn't get the form handed to them and showed them how to fill it out. And
that wouldn't have happened. I guarantee it.
No.
Someone accidentally changed Medicare Advantage plans. I've seen this happen several different times.
Yes.
Either a person, an agency or a call center will call and, pretend they're with the writing agent and they're not. But it happens often where I accidentally got on a different Medicare Advantage plan. What do I do? So what's the silver lining there? Because you lost your commissions. You lost a client. What's the silver lining?
So I was reading that slide thinking about my situation that just happened, and I was completely ignoring your question.
I don't know. I think a lot of people here completely ignore me.
I was
That's
trying
okay.
to think of what client that was just happening to. And so my client had been my client for several years, was in an MA only plan. And she thought it was someone from my office calling her. He had told her that, there's a new United Healthcare plan that's even better. So she switched last AEP. And, well, she's a Champ VA person. And so she gets her meds from the VA. She really liked that Part B give back.
Yeah.
And just did not like the plan. And so she called me and was just like, I learned my lesson. I am never talking to anybody other than you. You are my girl.
Were you able to switch her using OEP?
Yes.
Good.
Yeah.
I think that's the silver lining, is knowing that, like, when it happens, one, for that client, it'll never happen again. But I've seen agents actually, like, take testimonials from those types of clients because, like, they're so thankful for you that you were able to fix them.
Absolutely.
Take those testimonials and be like, I did this on accident. Please be vigilant. Like, and just kind of a warning to watch out for, like,
Yep.
And I always say, like, use your social media to be like, if you don't get this, if you don't hear these people's names, right? So, like, your name or any of your office staff, if they don't tell you, like, keep this list of names. If it's not one of these names, do not accept the phone call.
Yeah, and I like to say, like, there might be, because multiple people from SBS might call them, but no one will ever talk to you about changing a plan except for me.
Yeah.
Like, you might get calls from my office, but no one will ever switch your plan except for me.
Yeah. So.
But, yeah, my silver lining was, she was one that I wouldn't say she stood out. You have some clients who are like, they're going to be with you forever. Like, they're just those types of clients. She was one, like, she's been my client for a few years, but we didn't have tons of communication. I didn't feel the love necessarily.
Yeah, you facilitated her needs, and that was the extent of the relationship.
And after this, she was like, you're not going anywhere, are you? Like, you are my girl. I hope you're not going anywhere.
Oh, I love that.
So, yeah, there was definitely a silver lining in that.
Yeah, stronger relationship.
Yes.
See, it's not always sunnier on the other side of the fence. The grass isn't greener always. Yeah, green grass. Water your own yards. The next one is one that, like, you're working with somebody who they're frustrated. They can't afford a Medicare supplement. And they're nervous about going the Medicare Advantage route. Maybe they've heard horror stories, or they've talked to, like, friends who are in the healthcare industry that are saying, don't do it, don't do it. Silver lining.
Yep. So my specific example, she was a nurse at an assisted living, and she had seen over and over MA plans just deny services. And so she was like, I do not want an MA, but it's just finances were tight for her. Mm-hmm. And she was like, I cannot afford, $150 for a plan G. Mm-hmm. And so I offered her, I was like, we looked at a plan N, and I said, but high deductible G is even cheaper. Mm-hmm. And she was very healthy, didn't take any medicines.
Nice.
And she was just like blown away. She was like, I thought I knew Medicare, but, I've never heard of a plan N or a high deductible G.
No one talks about it.
And so I don't know what the silver lining in of that one. It's just that
the silver lining is
proved
like
my expertise, maybe.
Yeah, I think it's like finding critical problem solving, creative problem solving, having the education to be able to say, or like, and again, if you guys don't know that, our office does, right?
Yeah.
So having the ability to critical think, having the ability to problem solve in a case of like, hey, what don't you like about this? What do you like about that? How do we find a solution that fits both of them?
I think Brian just found my new TikTok handle.
Medicare. I love that.
Whoa.
Did you not think of that before?
I never thought about
Me
that.
Me neither.
Brian.
Don't give him too much credit.
Whoa.
You're fine, Brian. At best.
My gosh. I am mind blown right now.
I'm going to see Brian.
How good of that is my TikTok name?
Medicare. You gotta do it now.
I could do hashtags of Medicare.
Medicare. First, you gotta make sure it's not taken. I bet
Can't be.
Medicare's taken. Gross. Medicare.
Oh, thank you, Brian.
I will
That was
see.
genius.
I will be seeing Brian this Thursday. If you guys are in the Kansas City area, myself, Clayton, Kendra, and Gio from our office will be doing a training with the Medicare Sales University. So we will see you guys there. If you guys are interested in going to that, let me know.
Fun.
We're also doing another one in Iowa next month. So if you're in the Iowa area or in the Kansas City area, let me know.
I've heard a lot about Iowa lately. What's going on in Iowa?
There's just a lot of untapped opportunity in Iowa.
Are there just like a lack of agents up there?
Not necessarily. Iowa is a state that is 100% a cult brought to you by Blue Cross Blue Shield. Every agent and their dog prefer to write Blue Cross Blue Shield, and it's getting to a point where, like, it's not sustainable anymore. So, new product, needing new things. A lot of people are coming, a lot of companies are getting into Iowa for that reason, because there's just a lot of untapped potential there.
Does United Health, this is totally off topic, does United Healthcare have a larger footprint, like nationally, of Medicare enrollees, or is it Anthem? Would have to be United.
MedSup. No, sorry. United Healthcare.
United Healthcare.
United Healthcare is, for Medicare Advantage, is number 1, number 2 now for Medicare Advantage plans, but MedSup is number 1 by far.
United Healthcare is number 2 for Advantage?
I'd have to double check. I think
second to Anthem?
No, not to Anthem.
Second to who?
I hate to even say. It's the big ones that you're going to have to with Medicare Advantage is Aetna, Anthem, Humana, UHC. Humana didn't have a great year this year.
UHC isn't number 1.
It could be, but UHC had a really tough year this year.
Yeah.
Aetna had the best year they've ever had in the history of ever. I don't know if they're number 1 nationwide, though.
Nationwide. Just curious.
I think that's where it's either UHC or Aetna.
Okay.
Anthem is up there. Anthem's probably going to be like number 4. 4 or 5. Humana is another one, but Humana had a rough year, even more rough than UHC.
On the MedSup side, Mutual of Omaha has to have a large footprint too, right? Or is that just in the Midwest?
So it's a pretty large footprint. UHC is still by far the number 1 MedSup sold. Okay. Follow pretty quickly behind with Mutual of Omaha, but the market share there is still a pretty wide gap.
Okay.
Mutual of Omaha claims to be they are the oldest. The first MedSup ever issued was a Mutual of Omaha policy. They're also like the first to the game with an e-application, but AARP's MedSup with UHC kind of takes the cake for market share.
They're my 2 most enrolled in.
Yeah, that would make sense. That would follow the market, right? The next one I wanted to talk about was drug plans, the silver lining in drug plans. I work with so many agents, and I actually just did a seminar in
You mean like actually doing them for clients?
That refuse to sign up drug plans.
Yeah,
they'll do the MedSup, they'll do Medicare Advantage. They will not do prescription drug plans because they require the certifications and they pay very little to do, right, to get them. But I am 100% prescription drug plans, the number 1 referral system, the number 1 retention tool, because it's the only plan that they pretty much use on a monthly basis. And it is the best way to find premium or to find dollars for somebody because there's so many things you can do to manipulate those drug prices by going to the right pharmacy, being on the right plan, maybe using a discount code instead, or using one of those new pharmacies that only offer they don't offer brand medications. They only offer generics for extra savings. So there's a lot that you can do to advise people to save money.
And I think one of the best tools, like so many people I meet with, and they might have a UHC MedSup, and I will tell them, you have the right plan. It is the most cost effective. It is right for you. But let me look at your drug plan. And like by me not trying to touch that builds so much credibility that I'm not just in it for the sale. Year 2, year 3, they're mine.
Yeah.
Piece of cake.
Yeah. It's literally like.
Happens all the time.
I say like it'd be like going to a dentist. I always say this when it comes to drug plans. I couldn't imagine going to a dentist that didn't do the cleanings. right? All they did was exams and fillings and like the big stuff. If they didn't do cleanings, they said you need to go somewhere else or like you do your own cleanings. No, I'm gonna go somebody that takes care of me holistically. Right. I know the cleanings aren't the reason I'm there, but like I expect that to be done. That's why I'm here. You're here for my teeth. So making sure that again, the silver lining in DVH or in dental plans is not going to be the profit maker, but it is going to be something that gets you more business, keeps the business on the books, and allows you to reinvest dollars into other plans. The last one I have here is certifications. I hear this one a lot. I have to do certifications every year.
Agent frustration here.
Yeah, and agent frustration. I have to do this every single year. I'm tired of having to do this. It's 100%. You should be advertising. Back in the day, I used to say like a little while ago, but like 10 years ago, 11 years ago, I used to be a personal trainer, and that was something that was really easy to do. Yeah, I was a personal trainer for a few years, and we didn't have to in order to keep your license, but you did go ahead and like do classes and like get different certifications, like Zumba certified, CrossFit, yeah. And it was so easy to be like, ask if when people were shopping personal trainers, you would say, ask your personal trainer to show you their certifications because you actually didn't even need a license in Missouri to be a personal trainer. I know. It was so easy. If people were shopping personal trainers, I got them every single time because I was like, I do these courses. I stay up to date with these trainings, these certifications. If your trainer can't show you these certifications, then you don't want them.
Yeah.
So it was so easy to sell against them, advertising like, hey, I have to, in order for me to keep my license, in order for me to keep up to date, I have to train, I have to do this education. You need to be working with somebody who's staying up to date in the market. That's what certifications are for you guys.
I had a presentation last week there was about 20 people. It was at a bank. It was their private banking team and their wealth management team talking about Medicare. And at the end, they had a bunch of different questions about working with me. And one of them specifically asked, how did he phrase it? Not what credentials I had, but what sets you apart? Like, how do you represent all of these carriers or something? And I told him all that. I was like, I take the time every year to relicense and recertify with every carrier. I most likely am only going to sell 2 of them.
Yeah.
But I get licensed with all of them so that I can truly be unbiased and help that one person if that wants that.
That's a really great point. I'm unbiased. I can do any of them.
They were just like, oh my gosh. Because, most financial advisors, they have to keep up with their CE and stuff. Right. But they were like baffled that I had to like retest.
One.
Yeah. And so that like really took me up a notch, at least with that guy.
Well, and it's also like...
it's not talked about. And it like...
No, we bitch about it, but we don't talk about it.
Right.
I think, like, it's also important to realize, like, the barrier to entry, it kind of raises the barrier of entry to people who are actually serious about being in this industry.
Yeah.
So, like, we know that a lot of people, since 2020, people have rushed into the insurance industry because it's the cheapest way to become your own boss. You have to pay to take a test, and then you pay an extra licensing fee, depending if you're an individual or a business, and that's it. You're ready to go. You can start selling insurance the next day, honestly. And so it's really affordable to do that. People rush into it. But whenever they realize they have annual certifications, whenever they realize they have to do this every single year and they have to do it with every single carrier, that barrier to entry gets a lot higher. So it makes sure that people who are in this industry are in it and not going to be, and not just somebody
dabbling
who's
in it.
Dabbling, for sure. It kind of keeps the dabblers at bay.
What did Phyllis say? Recently had the talk with a healthy biking exercising client, why he has high deductible G and PDP versus MAPD. Friend of his bragging about MAPD denial. My client has a 100% non-Medicare MD.
Yeah. I don't know what 100% non-Medicare MD is.
You mean like they see like a naturopathic doctor who doesn't bill Medicare?
What a word. Naturopathic?
Like a holistic.
Holistic.
Like a naturopathic.
I like that word better. I'm going to start sprinkling it into everyday conversation to see what people have to say.
I didn't realize that was.
I love this new restaurant. They're very naturopathic.
No, it's a type of doctor, like a natural doctor.
Burrito is just giving naturopathic.
No, you can't use that word.
You can't tell me what to do.
Doesn't work there, Joey.
No one will know. No one will know.
You're using it wrong, Joey.
I disagree. I disagree strongly. Awesome, guys. That is what we have today for the Medicare Cafe. So hopefully you guys, again, the whole idea about this is just to find the silver lining in some activities that we don't like to do, as well as like how do you turn a bad situation into an opportunity with your clients. I know a lot of people get really frustrated, especially with like ancillary product sales, where they're like, I don't want to sell ancillary because then I'm going to be expected to do claims. Right? Because with Medicare, it's all streamlined. It's all behind the scenes. Agents don't have a lot to do with claims unless there's a problem. I think every issue is an opportunity because it's really important that you remind your clients what your value add is. We as an insurance industry are not convenient enough to compete with more convenient means, like online, enrolling yourself online, using a call center. So we have to be providing value somewhere. Every single time there's a problem, an issue, it's an opportunity to show your value. So take full advantage of it. And when you fix something that's broken, you will get referrals every time. When you fix something that went wrong, even if it went wrong because of something you did, if you take ownership of it and you fix it, you will still get referrals every time.
Just got to change your mindset.
Kills animals. She's a naturopathic. I don't know. I eat dead animals. I don't kill them, though. Flies? Do flies count?
I thought you did hunt.
Oh, I do hunt. No, I do. I do kill animals. I do hunt. Okay. This took a turn. Thanks for coming to my rescue, though.
Yeah, no problem. It's like, I'm pretty sure you hunt.
I am a Bambi killer. For sure. For sure. Duh.
Oh, too funny.
Awesome. Appreciate you guys so much.
Medicare. That is what I took away from this.
I think that's great.
I think it's really great.
We gotta run with that.
I'm gonna somehow fit that into my
whole
TikTok.
Marketing campaign about
Ben, are you listening? You helped me with my TikTok last time.
Medicare.
You did help me.
Awesome. Appreciate y'all so very much. We will see you next Tuesday. And will I be here next Tuesday? Yes, I will be here next Tuesday. So I will see you next Tuesday.
I'll see you in 2 Tuesdays.
My travel is like picking up again. So there might be some Tuesdays. I don't think anybody's too upset, Brian, that there's going to be some Tuesdays coming up that I'm not available. But again, if you are in the Kansas City area and in the Blue Springs area, my team and I will be partnering up with other integrity partners to bring you the Medicare Sales University. We'll be talking about cancer insurance, future of MedSups, future of Medicare Advantage, hospital indemnity plans, home health care plans, and final expense. Getting to hear from agents like you. So we're going to be there then. And if you are in Iowa, in the Des Moines area, that will be next month. So if you're interested in attending those, let me know and we'll get you a link. So awesome. All right, guys. So until next time, have fun,
make money,
and give impeccable service.